The world of adult congenital heart disease, be it during pregnancy or without pregnancy, is only going to grow. Where I see this going is that newer technologies are going to be coming in. And what does that mean? Well, maybe there will be stem cell research that has not been applied in the world of congenital heart disease in adults just yet, but maybe that is the future. Can we do angiogenesis, which basically means can we recreate vessels? Can we remodel the heart by using stem cell therapy? That hasn't been done in adult congenital heart disease. That is being done in the world of adult cardiology when it comes to MIs and coronary artery disease. So can you take those leafs or leaflets out of the world of adult cardiology? Can you put it into congenital heart disease? Well, I think that's the way to go. Very successful. So the stem cell research is up and coming. It's been around for a few years, and the data that is coming from coronary artery disease and myocardial infarctions has been very enterprising. So I do think that is something that's going to come into effect as we go forward. So not in congenital heart disease, and in the United States, I don't know of too many people who are using that in congenital heart disease. The way congenital heart disease works is that we take nuances from adult cardiology and maybe nuances from pediatric cardiology, and we apply it to adult congenital heart disease. So I think going forward, that is probably something that we will probably turn to. There are mechanical devices which we use in adult cardiology. So let's say a 75, 80-year-old person comes in with a massive myocardial infarction and needs what's called a artificial heart, which we call ventricular assist devices. We do that at a drop of a hat in adult cardiology. We don't do that in a drop of a hat in a 30-year-old who had congenital heart disease. So if you have heart failure in an 80-year-old or a 70-year-old, and you have heart failure in a 30-year-old, we don't rush to ventricular assist devices in a 30-year-old. And you almost have to take a step back and say, well, why not? Why, I mean, if I have to pick an artificial heart, why aren't I using it for the 30-year-old? Why am I using it for the 75-year-old? Mm-hmm. And that's a great question, because the complexity of congenital heart disease is so high that sometimes the way the heart is, you've had multiple open heart procedures, you have what we call plumbing issues where everything has been connected surgically, and it is not that easy to then put an artificial heart. Sometimes, if you believe this, the left side of the heart, or the left ventricle, normally, as we know, goes to the aorta. But in congenital heart disease, sometimes the ventricles are switched. So the right ventricle, which would normally go to the pulmonary artery or the lungs, in my world of congenital heart disease, the right ventricle could be sending blood to the aorta. So it would be going out. So everything gets flip-flopped, can be switched. In such patients, just applying artificial hearts or ventricular assist devices gets very complex. The data hasn't really come forward as to can we do this successfully. In the last 10 years, this data is now increasing. We are seeing more and more patients and more centers using artificial hearts and ventricular assist devices in congenital heart disease. They are external devices, they are cumbersome devices, but with technology and with research, they're being modeled so and so that you're now getting towards smaller devices. And I do think that as we go forward, that's really what's going to happen. These devices will change, they will modify, they'll be easier to use, they'll be less cumbersome, and hopefully we'll be applying that more and more to adult congenital heart disease. I really believe that is the way to go forward. Same thing when we look at transplant. In adult congenital heart disease, if you think about this, a 35-year-old who has adult congenital heart disease, has a severely failing heart, has had 3 open heart procedures, getting that patient a transplant is sometimes twice as hard as getting a 75-year-old who had an MI. And if you think about it, a 75-year-old with an MI gets a heart sometimes a lot easier than the 35-year-old who's having a failing heart. Again, it's just our world. It's just so complex that we are still developing the nuances, but I think that's where we're going to go. It's only going to grow. It's only going to grow.